Hi, hello everyone. Welcome to Eye Care Optum. Today I'm going to discuss about contact lens fitting. When it comes to contact lens fitting, we have a two method. One is empirical fitting, second one is diagnostic fitting. Both the methods are based on total diameter, keratometric reading, back vertex calculation and manufacturer guidelines. In empirical fitting, we'll prescribe the contact lens power without any contact lens trial. But in diagnostic fitting, we'll prescribe the final contact lens after a contact lens trial. In practice, this diagnostic fitting method is followed as a standard method for contact lens fitters. For a soft contact lens fitting, we need to check for three key elements. First one is pre-evaluation, that is baseline measurements. Second one is trial lens selection. Third one is fit assessment. In this video, we will be discussing about pre-evaluation baseline measurements of soft contact lens fitting. The first one is slit lamp examination. This is to identify any pathology in anterior segment or in eye adnexa. We should check for eyelids, bulbar and palpebral conjunctiva, cornea, anterior chamber, iris, lens and tear film. The second one is HVID, horizontal visible iris diameter. This is important in contact lens diameter. Normal average HVID is 11.7 mm. This can be measured with normal millimeter scale or slit lamp or corneal topographer or vernier scale. Total diameter for the soft contact lens will be HVID plus 2 mm. Third one is palpebral fissure height. This is basically vertical distance between upper and lower lid margin through the central cornea at primary haze. Average normal height is 10 mm. This can be measured using millimeter scale, slit lamp or corneal topographer or with a vernier scale. This measurement also helps us in deciding a diameter. If height is higher, we can go for a higher diameter. If it is lower, we can go for a lesser diameter lenses. Fourth one is pupil size. Normal pupil size in bright light is 2 to 4 mm. In dim light, it is 4 to 8 mm. This pupil size is important to identify the optic zone in contact lenses, and also this should be checked in dim room illumination. Optic zone will be calculated as a pupil size in dim light plus 2 mm will be added into that. Fifth one is keratometry. This is to identify the base curve of contact lenses. Base curve is equal to 337.5 divided by D. Here D is average dioptric value. Sixth one, we have some additional tests like tear film evaluation. We can check with the Schimmer's test, debut with invasive or non-invasive technique, tear meniscus height, and one more iris color. This will help us for a color contact lenses. Trial lens selection for contact lenses. When it comes to trial lens selection, we should look for three main factors. First one is total diameter for contact lens. Second one is base curve for the trial lens. And third one is estimated power for the trial lens. First, the total diameter will be calculated as HVID plus 2 mm. Here HVID is horizontal visible iris diameter. If patient has 12 mm of HVID, with that we have to add 2 mm. The final diameter of the contact lens will be 14 mm. Second one is base curve. Base curve is the radius of curvature of the back surface of the contact lens. For selection, you can go with two methods. One is add 0.8 mm to the flat K, or the second one is select 0.6 to 1 mm flatter than average K. Here we have a formula of base curve equal to 337.5 divided by D. Here D is average K. If patient has average K of 45 diopter, base curve equal to 337.5 divided by 45. We'll get 7.5 mm. Here we need to select 1 mm flatter than this. So final base curve of this trial lens will be 7.5 plus 1 mm. it will be 8.5 mm. Third one is estimated power of contact lenses. Here we have a formula of back vertex power equal to F divided by 1 minus dF. Here F is spectacle power, D is vertex distance in meter. If patient has a refractive error of -5 diopter and vertex distance of 12 mm, according to the formula, we'll get 4.72 diopter. So the estimated trial contact lens power will be 4.75 diopter. Soft contact lens fit assessment. In soft contact lens fit assessment, we need to see these 8 main factors. One is centration, coverage, movement, push-up, lag, age, comfort and modification. First one is centration. Centration is superimposition of center of cornea and center of lens. In optimal and stiff fit, it will be centered. In flat fit, it will be decentered. Second one is coverage. Ideally, 1 mm of symmetrical overlap will be present. It means the lens will extend 1 mm beyond the limbus in all positions. In optimal fit, it will be completely covered. In stiff fit, it will be decentered and poor recovery. In flat fit, lower riding will be there. Third one is movement. Movements are very important in tear exchanging. It depends on lens type, design, material, lid factors and anterior anatomy of eye. We usually see the movements vertically. In optimal fit, you will see 0.3 to 0.6 mm movement. In stiff fit, less than 0.2 mm. In flat fit, more than 1 mm. Fourth one is push-up test. In this test, the lens will be pushed with the finger with the use of lower lid. Here we need to observe two things. One is pressure we are applying to push the lenses. In optimal fit, 50 to 60% pressure needed to push the lenses. In stiff or tight fit, we need more pressure to push the lenses, more than 70%. In flat or loose fit, only less pressure needed, less than 40%. And the second one is, after pushing the lenses, we need to note the recovery. In optimal and flat fit, it will be quick recovery. In stiff fit, it will be slow or nil recovery. And the fifth one is lag. Lag basically resistance of lens to move with the eye in all gazes from the primary gaze. We will ask the patient to look up and ask them maintain the position without blinking. Simultaneously note the centration of the lenses. In optimal fit, you will see 1.5 mm lag, and in stiff fit, little or no lag will be present. In flat fit, more than 2 mm will be there. And the sixth one is edge. In optimal fit, there will be no indentation. In stiff fit, indentation will be present. In flat fit, it will be flirting. And the seventh one is comfort. In optimal fit, comfort will be good. And stiff fit, initially it will be good. In flat fit, it will be poor. Eighth one is modification. In optimal fit, we don't need to do any modification. In stiff or flat fit, we can follow Papsam rule. Here, to make it flat, add plus. To make it stiff, add minus. Means, if it is stiff fit, you can flatten the base curve. If it is flat fit, you can stiffen the base curve.